What is the best and longest lasting facelift technique to lift heavy jowls? I am confused by different techniques and vectors, etc. It seems conclusive that the SMAS is the key, but is an extended high SMAS lift different from a standard SMAS lift? What's the difference between plication, imbrication, SMASectomy, etc.? What about a max lift? Is this an imbrication technique? What is a purse string? Where should the lift be sutured to achieve long-lasting and effective jowl lifting? A lot of people on this website seem to have recurrent jowls after full SMAS facelifts. Why?
Thank you for your question. You're asking what is the best and longest lasting way to treat heavy jowls? And you ask in your question about the various techniques from high SMAS, SMASectomy, max lift, deep plane. I mean, basically you provided a laundry list of all the different techniques, and you state that you see in this medium that people after full SMAS facelifts have recurrent jowls. Well, the type of question you're asking is the kind of question that people who do this type of surgery have been asking for decades. And the best technique, it doesn't really exist, because the human body is going to have a lot of variability. And the reason and I'll explain it further. As a background, I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I specialize in helping people look better, specifically in the area of facial aging. And I do all those procedures, and I've been in practice over 20 years in Manhattan and Long Island, and I treat patients who come for these procedures from all over the world. I can say that there's the marketing elements of facelifting surgery, which further confuses matters. There are doctors who claim that they only do deep plane facelifts, implying that the other doctors don't do that procedure, or that they're doing something that's complicated and other people are not as brilliant as they are. That's just not the case. You know, every surgeon who performs facelifting surgery, who is properly trained and has experience, can do all those procedures that you just listed and more. And when it comes down to it, at a certain level of experience, you really are customizing even further, because you are using your knowledge and experience to get the best result for that patient. And so that essentially means that there is something missing in the equation as to why you noticed that people do get, quote, recurrent jowls. And there's a few things. So the limitations of facelifting have to do with the realities of what the factors are that are related to facial aging. And facial aging is basically two things. It's volumetric loss, which means loss of bone, muscle, fat, soft tissue. And it's sagging, descent, and weakening of tissue. So that means that you're lifting against a structure that has less volume, and you're lifting with tissue that is more elastic. So a colleague of ours once said that the skin is like taffy, and it's very, very stretchable. So whether you go very deep or whether you go more superficial, in the end you are still lifting the foundation of the face, called the SMAS, or superficial musculoaponeurotic system. But the weakest link in this chain is the tissue quality. And so there is invariably a certain amount of regression. There's the skin of the neck can stretch a little bit. You turn your head, you look up and down, it's going to stretch a little bit. The face will stretch a little bit, just normal movement and expression. So I explain to my patients that if you're a candidate for a facelift, My job is to first reposition, put everything back as to where it should be. But it doesn't mean volume correction is not going to be appropriate. Now, volume correction can be the use of chin implants, cheek implants to restore volume, or volume correction can be the application of fillers, structural volumizing, placement of a thicker hyaluronic acid filler at the deeper levels so that after the facelift is done, you can also get this volume restored. In fact, there are times when I would do a limited facelift and combine it with injectable fillers to restore volume concurrently. There's a lot of art to this type of practice, and there is a lot of finesse, and there's a lot of variations in the personal style of different doctors. Imagine if there was just one way to do the best job possible, then everybody would do it exactly the same way. And that's just not a reality. If there was only one way to do a facelift and that was the best way, you can be sure that every doctor who trains in this field would do exactly that. I think that what you're dealing with is just the elasticity of the human body and the variabilities in the ways we can lift the face and neck area. So I think that you have to if you're interested in doing anything, meet with different doctors, learn about the options, learn about the different anesthesia scenarios. Every doctor comes to this with the perspective that they're doing the best job they can with the knowledge and experience they have. And where there is a problem, where there are problems, is when doctors engage in turf battles and disparaging other doctors and stating that they're more capable or better qualified, and it just serves to confuse people unnecessarily, because I think that majority of the time doctors who offer these procedures do have appropriate experience, and it's just a matter of finding the right fit. In terms of the style of the procedure, in terms of the anesthesia, in terms of the overall vision that you and the doctor share about the outcome. So I hope that was helpful. I wish you the best of luck, and thank you for your question.